I'm here to compliment the associates, having been immediate past president of the medical staff, kind of on the inside, realizing just how generous the associates have been for the past 30 years.
In general, giving for me is giving back to the community. And I think every person is responsible to give back to whatever they consider their community. For me, it's O'Connor Hospital. As a fundraiser, I'm going out in the community, raising money, and I've used the associate campaign as a wonderful example. These people work hard in the hospital, they give it their all, and yet they are happy to give to the hospital and make it a better place.
When I first came, I think that's what I saw. The mission of O'Connor Hospital definitely matched my own personal mission, which is to care for families of needy backgrounds. I grew up in San Francisco as a needy family, want to give back, want to help, want to make sure healthcare is a right, not a privilege, make sure healthcare is equitable. I trained in Philadelphia where I always, we had social workers and health educators who worked as a team to address the needs of the population that we cared for. So I want to bring that model here. And we eventually got to that. It took a few years because of funding again. And we have now a health educator, a social worker who works with us to help care for the patients.
I have a 5-year-old daughter who's been a patient at Pediatric Center for Life for the past 5 years. So they haven't just been her caregivers, they've been the people who care for her. She loves Pediatric Center for Life and they love her. Even today, if you go into their office, you can see a picture of her. She is their #1 fan.
At the Pediatric Center for Life, we have 100% giving because the staff at the clinic believe that the Daughters of Charity are serving the poor, and we witness the poverty of our society every day. And it's hard not to give when you know people go home and they don't have electricity, or they don't have a car, or they don't have food. So to give in the Associate Giving campaign is you are giving to help others, and you don't have to give a lot. If everyone gave, we would have the ability to touch more lives.
So the collaboration between us and the hospital, where they take care of the clinic side of it with the foundation support, we're able to come in here and provide care and able to afford to provide that care for the patient.
I think it's important to give to O'Connor Hospital because the money goes back into the hospital and it benefits our patients, and through some of the equipment and other things that we get, I can see how my donation directly impacts the care I give to patients.
Giving is a real simple process. You sign a form dedicating how much you're willing to give each pay period, and it's automatically deducted out of your payroll check. You don't miss it. You can use it, in fact, if you want to have a tax deduction, so it benefits you as well as the organization. It's a really quick and easy thing to do.
Well, I've seen some positive changes, especially in my department, imaging services. And so I actually see where my money is going to, so that's a very rewarding feeling. The way I do it is by doing it annually, one-time donation. It's important to give because this is our second home.
I just feel that it's necessary for the community and the patients that we have at O'Connor Hospital that we all take part in and give to the hospital, because I just feel that it's the right thing to do.
It is the dollars that you give that make services available to those that we serve that would not be there if it weren't for you.
Giving is very, very important. It's painless, actually. I tell them how much money to take, and I don't even miss it. I don't even realize how much I'm giving sometimes. So it's really easy, and it makes you feel good, especially when you see all the good things that the money has done.
It's really because of them that I could do my work, and then we can do our work together to care for the needy families of our community.
So those who have given, I say thank you, and those who have not given, I say, please give.